Welcome. Welcome to hdhbhsa.com. Health disclosure, healthy pricing with health solutions advantage, which is otherwise called health insurance personalized. This is a financing segment, folks. On behalf of consumers, doctor, on the behalf of foremost organization. Today's topic is cost of being voluntarily uninsured. Cost of being voluntarily uninsured. We have had 27 million uninsured in 2010. That's how the Obamacare kicked in because of too many uninsured. Now, we're going to address that uninsured and how we can solve it under the personalized healthcare, so-called HDHP, HSA umbrella. So-called free riders, people who don't buy the insurance coverage, their problem is solved, folks. It's easy. Basically, people, when they don't buy the health insurance, they lose federal and state personal tax deductions, which helps them. By losing exemptions, the state and federal will be collecting more revenue from the free riders that will help to finance the impaired health support plans for those who choose to be uninsured but will eventually be uninsurable because of lack of insurance. So these free riders, so-called free riders, there are always, we all know, there are always some people take advantage of the situation. With Obamacare, there are plenty of ways people get insurance they want without paying their fair premiums. They're called free riders, folks, free riders. Under the Obamacare, free riders can deceptively claim lower income than they really have when they're enrolling. They would have to get a large subsidy. They would have to get a large subsidy than they're entitled to. They can pay a few months of premium when sick and drop out, then when recovered, only to re-enroll later when they get sick. Let me repeat this again. People deceptively claim lower income while they're enrolling it. Then they would get a large subsidy than they're entitled to. They can pay a few months of premium when sick and drop out, then when recovered only to re-enroll later when sick. The uninsureds can simply show up at a hospital emergency room and they're guaranteed care under the EMTALA rules and regulations. Hospitals have to provide the care for the uninsured under the EMTALA. So there has to be a cost to being voluntarily uninsured as long as we as a society agree to compassionate care for all. Compassionate care for all. When all is said and done in a voluntary system, There will always be those who choose not to be insured. Who choose not to be insured. Choice is good. It's what we all want. But some uninsured individuals may be healthy and consider any insurance premiums as unnecessary expenses. That's what they do. They may look at it as unnecessary expense, so they won't. So few may even be rich enough to pay cash for any illness, and all claims they may suffer. So these people are costing for the rest of the folks. So whenever they choose not to buy insurance, they lose those exemptions under the personalized health care. When people are rich enough to pay cash, they also are rich enough to lose the exemptions. Just like there is a 100% probability that we will all die. At some point, everyone will need health insurance to access the health care. That's the most likely probability. We all die 100%. But when healthcare is ultimately needed by the uninsured, any condition or illness or accident presented to them will be considered a pre-existing condition. The only insurance option will be impaired health support plans. Impaired health support plans. Under the personalized health insurance, folks, during the period of being uninsured, individuals will lose all or a portion of their personal or family income tax exemptions. That's very important. They lose the exemptions. And the revenue what the federal and state collects, those funds will be used to support the subsidies for the impaired health support plans. So those are the funds coming from losing exemptions for few who don't buy the insurance. Those voluntarily uninsured will eventually need the benefits of the impaired health support group. That's how we raise the revenue from people when they lose the exemption for not being insured. Consider the penalty, the forfeited funds, a prepayment coverage by a voluntary uninsured towards the impaired health support group. It considered that as a penalty for not buying insurance. That's what is happening. The process to do this is as follows. The State Department of Revenue and IRS will calculate the increased income tax from returns showing loss of exemptions and submit the tax amount to cover the claims and other expenses for the impaired health support groups. That revenue will go to the impaired health support group. Low income tax individuals in need of a financial help can get a premium subsidized health insurance. So one way we are paying the impaired health support groups by taking away the exemptions for people who are not insured, voluntarily or involuntarily. People, when they don't buy insurance, there are consequences. Consider that as a penalty. This is the solution for people when they don't buy insurance. They lose all those state and federal exemptions. That will help to support the impaired health support plans, either economic or physical or disability, whatever, but it will be under the umbrella of Health Review Authority. Health Review Authority will receive those funds from the state and federal revenues. That's how we are able to provide the care. So one losing the exemption, the other one is gaining the coverage, especially for who need the most. That's how we compensate. So when we collect more revenue, we pay for the impaired health support plans. This should work, folks. This concept of losing exemptions for the people who voluntarily don't buy insurance will support the impaired health support plans. I hope you got the point I was trying to raise. Thank you for listening, and we will see you next episode of Health Insurance Personalized, so-called HDHSA.com. This is Consumers Doctor on behalf of Foremost Organization. We will see you. Salute.